morning, Miss Lucy.
Good morning.
How are you feeling today?
I feel fine.
I'm glad to see you. So, my name is Sari, one of the second year medical students. And I've been sent here by one of the doctors to come and check on you and get some important information from you that will help us plan for your treatment and management. Okay. So before we start, I want to assure you that the information that you give to us, or the information you give us, will remain between you and the medical team.
Okay.
So are we good to proceed?
Yes.
First of all, I would like to know your full names.
Lucy John.
Okay, Lucy. So the doctor told me that you are here in Africa, right?
Yes.
And you are diagnosed to have diabetes.
That's right.
You are released on diabetes medication.
Yes.
So I would like to know, how are you faring on?
Actually, I'm not doing okay at all. My husband has been complaining that I wet the bed, and I've been drinking lots of water. As you can see, I have my bottle here with me. And the last time I even bent my fingers without even noticing. And I've been experiencing cramping pains in my legs, visiting the washroom frequently. It's so frustrating. So frustrating.
Oh, I'm so sorry to hear that. So my other question is, for how long have you been having diabetes?
Well, the doctor made me aware that I've had diabetes for a very long time, but it was just when I came to the hospital he made me aware.
Okay. So when do you check for your glucose levels?
Normally I do that before breakfast.
Okay.
And then before dinner.
Okay. So what is your glucose levels at those times?
About 10.2.
10.2.
Yes, please.
So for how long has it been that high?
2 weeks. Roughly.
2 weeks?
Yes.
Okay. So have you ever had a drop in the glucose levels? Has it ever dropped lower than normal?
Yes.
Okay. Can you recognize the symptoms?
Yes.
Okay. What symptoms do you normally get?
Okay, normally I experience total general body pains, weakness, and anxiety, and I get some migraine.
Okay.
Very painful.
Sorry. So how often do you experience these symptoms?
Most often after my morning walks. I do that 3 times in a week.
Okay.
Yeah, that's when I experience those symptoms.
I want to congratulate you because you take your time to exercise.
Yes, thank you.
Yeah. What do you normally do whenever you experience a drop in glucose levels? Do you normally carry any sugar pills with you?
No, I don't.
Okay. So what do you do to prevent these episodes?
I normally carry little snacks like chocolates.
Sweets? Do you normally carry sweets?
Yes, sweets.
Okay. Are you on any oral diabetes medication?
Oh, no.
Okay. So you're taking insulin, right?
Yes.
What times do you normally take your insulin?
Actually, I have an insulin pump, so it works on its own.
What kind of insulin are you taking?
I think this pro.
This from?
Yes.
Okay. So do you need a refill today?
Oh, no.
Okay. I also have some questions I need to ask you about your diet.
Okay.
So what do you normally eat for breakfast?
Oh, I do tea with bread.
Tea and bread?
Yeah.
What about lunch?
Lunch, I do a bowl of banku with okra soup.
Okay.
Yes.
What about dinner?
Then I do jollof rice
Okay.
with fish.
So do you normally eat snacks in between the meals?
Yes.
Okay. What kind of snacks?
Oh, my normal chocolates.
Okay. Soda?
Yeah. Soda. Yes, I do. But I take the one with zero.
Zero sugar?
Yeah,
Okay.
zero sugar.
Okay. What times do you normally take your breakfast?
Normally around 7:30 in the morning.
What about your lunch?
About 12
12.
p.m. Yes.
Okay. And what about your dinner?
No, that's before 6 I should.
Okay.
Yes.
So, of these 3 meals, which one is the heaviest or the biggest of these 3 meals?
My lunch.
Oh, okay, lunch.
Yes.
Okay. So, do you normally eat vegetables?
Sometimes.
Okay.
Sometimes.
So, do you drink lots of water?
As you can see, I have my water here with me all the time.
I wanted to give you an advice about your diet. First of all, I'll advise you not to skip your breakfast and ensure that you eat a balanced diet. And your meals, ensure that 60% of your meals, they are composed of vegetables and fruits. And also, I'll advise you to eat lean portions of red meat and poultry. And you can consider buying fishes or using fish. It is a good source of protein for people with your condition. When you're going shopping, consider buying whole grain foods other than refined foods, because all grain foods are more nutritious and also they contain a lot of fiber. Also consider low-fat dairy. Also limit the amount of salt in your diet, or you can use other spices to supplement salt in your diet. That normally goes in hand with exercise, right?
Yes.
So I would like to ask you some questions about your exercise routine.
Okay.
So you had earlier told me that you normally go for morning walks
Yes, yes.
3 times in a week, right?
Yes, 3 times.
I would like to know, for how long do you normally do these morning walks?
For I think 20-25 minutes of walk.
Okay.
Yes.
I commend you. You're doing a good thing. Continue. But concerning exercise, I would like to tell you that it's good if you take your time to exercise about at least 30 minutes per day. And if you cannot make it every day, you can do it 5 times or 5 days, if not all days of the week. So many people or many patients who have been having a good exercise routine have been reported to have improved symptoms. Also, exercise helps you to keep your weight within normal limits. And some patients have been able to even discontinue insulin therapy with a good exercise routine. Exercise also helps improve insulin efficiency. It helps you feel good and your vascular health. Regular exercise helps you improve your memory and also improve sleep patterns. So you can engage in any exercise that you like, be it the walking that you are doing, riding, be it going to a gym or a spa. Yeah, just make sure that at least you exercise for 30 minutes. Earlier on, you had told me that you burnt yourself while cooking and you didn't even realize that you had burnt yourself. You've been going to the toilet frequently. Your husband is complaining that you're wetting the bed
All the time.
You've been drinking plenty of water.
Yes.
Okay. You also experienced cramping pain in your feet and legs.
Yes.
Okay. So I'd like to know, did you experience any other symptoms?
Yeah.
Okay.
Very eyes.
Oh, so you've been experiencing blood vision
Yes. Yes.
and any abnormalities on your skin.
Yes. My husband did mention that I got some dark spots at the back of my neck.
Okay. So we've been having a lengthy discussion, and I tend to have an idea of what this could be. So I want to hear from your perspective. Do you have any expectations?
Yes.
Okay.
I'm expecting that I'll be able to. Your team will be able to help me manage this condition because it's really, really unbearable.
So we're going to